Bone disorders. Osteoporosis. I've talked about this, but I haven't given it a name. That's when calcium and those other mineral salts have dropped below their functional range in our bloodstream, and our body's going to respond by releasing parathyroid hormone, and that is going to stimulate the osteoclasts. So those bad guys come in and start to reabsorb bone and release it into the bloodstream. Why does this happen? Well, think of it. Long ago, we can't contract a muscle without calcium in our bloodstream. So we're trying to run from the lion. Oh, no calcium in the bloodstream. Our body says, hey man, we've got to have it. So they pull it from, our body pulls it from the bone. It's a survival mechanism. It occurs when bone is being reabsorbed faster than it's being replaced or deposited. It's a gradual disease after about age 30. We no longer are depositing large amounts. But we can speed up this process of osteoporosis by smoking, by being inactive. If our dietary calcium and mineral salts are low, like we just don't have enough dairy in our diet, or vitamin D, sex hormones such as GH, and if you're very thin, you don't have all that body mass pulling on your skeleton, so thin people tend to be at risk of having osteoporosis. Carpal tunnel, well, the neighboring ligaments and tendons become inflamed, often because of repetitive motion, and they're going to press on the median nerve, which is also going to become angry and swell, and now we have carpal tunnel. It's going to cause pain until somehow the swelling is relieved through cold packs, a change in lifestyle, sometimes a brace, and hopefully not surgery. Osteogenesis imperfecta. Bone is really brittle unless it has its natural matrix of collagen and elastin fibers woven in, and in this case there's not enough, and the bone's going to be brittle and break, and growth is going to be stunted. It's not very common, this disease. You see the suffix sarcoma, we think of cancer. And this is not like a bone marrow cancer. This is something that tends to occur in the long bones, the knee joints, the synovials, and is a secondary spread from another cancer, such as from the lungs, prostate, breast cancer. Prolapse, also called herniated, but we don't call them slipped because, boy, we don't want those discs slipping. If you look at the lower right, you'll see a bulging herniated disc. Very painful because it's pressing on the nearby nerves. However, given some time and some physical therapy, change in lifestyle, these discs will regain their normal shape. So be patient. Gout is a symptom, really, of our body not managing its uric acid properly. And so the uric acid is going to accumulate in various synovial joints, not just the toe, but here's where it sometimes starts. These crystals are going to inflame the nearby bone, so we get something that looks like osteoarthritis. It's usually a warning that the kidneys are in danger and something needs to be done. Osteoarthritis, that's when the hyaline cartilage in the synovial joints becomes thin. Now this is often due to an injury or trauma. It's not. It's different than rheumatoid. In this case, I'm showing you the acetabulum, the hip socket, and that's where the cartilage is. You can see a lot of cartilage in the lower right, and this cartilage has no blood supply and no blood vessels because think about it. We run and jump, and if we had little blood vessels in our joints, they would burst and we'd be bleeding internally. So how does cartilage feed? Good question. Joint replacement is one treatment with a prosthesis. It is done, but we avoid it with someone who's young and active unless it's necessary, because these do have a limited life, although they're getting better. But cartilage feeds by being squashed, and it's squashed like a sponge, and then when it regains its shape, it reabsorbs fluids in the joint. So movement is a very important strategy for someone who's young and starting to develop osteoarthritis. In fact, research on monkeys show that the ones in the wild don't get osteoarthritis because they move a lot. They have these wide-ranging motions leaping through the trees, and that all helps to stimulate cartilage. Whereas in the zoo, there's not enough movement and the hyaline cartilage becomes thin. This has been my work for the past many years. I send my son up the trees in the rainforest studying how monkeys move, and well, I go up there too. And you can see my drawings of monkeys. I find that some of the older monkeys have beautiful femoral heads, the head of the femur, and the acetabulum is just marvelous. And the ones in the zoo, often they're nice too, but some of them have arthritis. They're just not moving enough in those zoos. Summary here. If you look at the main stories, there's just a few really. There's the concept of bone cells, osteoblasts, osteocytes living in the lacuna, being fed through canaliculi, and the osteoblast stimulation through the periosteum at the epiphyseal plates. But then if our blood calcium levels drop, then remodeling occurs with the PTH, and those osteoclasts are going to get busy releasing calcium in the bloodstream, but giving us osteoarthritis. Joints, synovial, the big ones, shoulder, back, knees, hips. Cartilaginous in the spine and in the sternum. Fibrous, the tooth sockets and the skull, especially you can see it in the fontanelles of a fetus. Osteoporosis, we just went over that story. Carpal tunnel, those neighboring tendons become inflamed and push on the median nerve. Osteogenesis, we're missing the important protein fibers such as collagen. Osteosarcoma, cancer in the long bones, tend to be a secondary site from another cancer. Prolapse or herniated disc, when those intervertebral cartilaginous pads bulge, causing pressure on the nerves. Gout, we have a uric acid management problem, and the other synovials and the kidney are at risk. And finally, my favorite story, osteoarthritis. You got to move like a monkey to feed your cartilage until the day you die.